Hey, everybody. Welcome to our regular Friday get together where we talk about what's new and coming up with lipedema. I'm Leslyn Keith, president of the board and director of research for the Lipedema Project. And I'm here with my friends and colleagues in crime. We have Gail Straker. Go ahead and introduce yourself, Gail.
Hi. I'm Gail Straker, and I'm the community manager.
See, you can't talk either.
Whose tongue is getting in the way.
That's right.
Right now. But anyway, and I've been with Lipedema Simplified for about, since 2020 sometime in 2020.
Yeah.
So 4 years.
And we're also here with Siobhan Huggins.
Hello, I'm Siobhan. I'm the research specialist with the Lipedema Project. Yeah, that's all you need to know.
And I mean, just talking about that, since you mentioned it, Siobhan, you being the research specialist, you're engaged in a research project right now, and are going to be presenting about it at a upcoming conference. Can you tell everybody about that?
Yeah, so now that the conference is coming up and we actually have all the data in hand, we did a group citizen science project to explore the use of exogenous ketones, which are a bioidentical ketone that you drink, and it increases your ketone levels in the blood and in the brain and all this stuff. So since we had seen some anecdotes from the community and from Carrie Reedy, for example, talking about exogenous ketones potentially being useful, not as a replacement for a ketogenic diet, but like when you're first in that adaptation phase, or when you have more acute flare-ups of things like pain, or to add on top of a ketogenic diet, as we found out. We decided to put this group project together from volunteers from the community, and we ended up working with American Ketone, who supplied the product, and it was cool. Like, experiments are always weird in that, like, obviously you're doing the experiment because you expect something to happen, but then throughout the entire thing, you're also like, nothing's gonna happen, and then something happens, and you're like, whoa, completely shocked. Yeah, I'm going to be presenting on it in Vegas at COSI, which is a conference being run by a friend of mine, completely focused on citizen science and collaborating between citizen scientists and citizen researchers and people who are professionally in the field, in the overlap that comes from that. So I'm going to be working on that a lot over the weekend to get my slides done, but I think it's going to be super cool. And yeah, I think this is probably something we're going to end up exploring more. And as a small sneak peek of what I'll be talking about, there was a lot of discussion of lipedema related pain from that group project. So look forward to more information from that.
That is interesting because what we've seen in literature, there's not a whole lot about exogenous ketones helping with pain. But as with the ketogenic diet, it seems like there's something, with the ketones that really help with lipedema related pain. So we really look forward to seeing this presentation. And just for those of you that don't know anything about the collaborative science conference that's happening, it's going to be in Las Vegas. I think, Gail, I'll get you a link that maybe we can post that link for people who think they would like to come, because several of us, including myself, Gail, and Siobhan, are all going to be there. And if you are there too, we'd love to meet you. So we'll put a link in there so you can find out more about this 2-day conference happening in Las Vegas, March 15 and 16. And of course, highlight of being able to see Siobhan present this breaking information. And I think you're presenting on Friday the 15th. Is that correct, Siobhan?
Yep, at 10:45, I think, either 10:30 or 10:45 Pacific time.
Okay.
So I'm one of the first. I'm right there in the morning, which is how I prefer, because it means after my presentation, I can relax for the whole rest of the conference.
And enjoy the rest of the conference. Yes.
Yeah. The absolute worst is when you're at the very end and you're just constantly thinking about your presentation the entire time throughout the entire conference. This is a much better option.
Yes. And, you know, I've seen other presenters at other conferences that they're presenting on the last day. And throughout the weekend, they're sitting there with their laptop, working on stuff and updating and making you know, because they want it to be a very good presentation. But now they're missing out on talking to all the other people that are there. And so that is not going to be what your experience is, Siobhan. So I'm glad for that.
And
yeah, and
Lisa wants to know if it's going, Lisa Dury. I know that. I know her.
Yes.
Know her? Okay.
Our very own managing director.
Yes. Managing director. She wants to know if the presentation will be recorded and shared with the public.
So I'm not sure, actually. I'd have to ask Dave. But if not, I'm sure we could get either Gail or Leslyn to record it and put it up for our community. The other thing that's worth mentioning is we already have plans to bring Heidi into the fold. She's with American Ketone, and do some further discussion on this group project with our own community. So it's not like I'll be presenting at COSI and then it's gone forever and we never talk about it again. Yes. We'll probably talk about it a lot in the future. This is just the first, very first dibs on the info.
Yeah. So if it's not, if the conference is not going to be recorded and then the video is released later, I mean, even if it is, I've already asked Gail if it's all right with Dave, if she just with her phone does your presentation, because it so happened that I'm going to be in a meeting all day Friday. And so I'm going to miss your presentation live, Siobhan. So I'm hoping that it's okay with Dave and that Gail can just use her phone and record your presentation. But I think you're only allowed to talk for 12 minutes. So Gail, your arm shouldn't get too tired.
Yeah, I think it's 14. I'm hoping it's 14 because I'm trying to figure out, because we got so much data back from this project. Like we had multiple surveys that were being filled out and measurements and all this stuff.
Yes.
And I think what I'm going to do is like a brief overview of each participant in isolation, and then a quick thing about the type of ketones that we were using. And I think I'll be able to at least fit in like the high points and some low points, which are important to communicate too. But yeah, it's one of the tackles of putting together a presentation is like you have to have this story put together so it's interesting enough to watch, and it's not just like graphs and lines and stuff like that.
Yes.
So yeah, it's a fun thing I'll be working on over the next week.
And you're particularly good at that and doing a short presentation and with an engaging story. And I think it helps. This conference, the COSI conference, is particularly geared to that, because this is talking about, it's citizen science, it's people that are experimenting on themselves. And so it's not like what I just did with the Gordon Research Conference. They're all talking about cells and animal experiments. This is talking about real people and your real experience. And so that, for me, that right there just makes it engaging and really interesting. So we really appreciate
another important thing to mention about COSI that we haven't mentioned yet, but is important, is that all of the proceeds are going towards the Citizen Science Foundation, which is a 501c3 nonprofit. So the Citizen Science Foundation ended up funding the lean mass hyperresponder study, which they've done their final scans, I think. Because Dave mentioned that before, it would be in February. So they've got to do the data write-up and everything now. But he's already mentioned a couple more things that is probably going to need to be funded by the Citizen Science Foundation. So
this is really just the start, you know?
Yeah, that's the hope, is that this is just going to be the start. They've got one study pretty much should be written up and done here pretty soon. But then also science tends to lead.
Will the findings be shared in the upcoming Lipedema Simplified Heart to Heart Conference? Well, thank you, Lisa, for mentioning this, because we can just go right into talking about our heart-to-heart conference that's coming up in April 12 to 14. And it's Keto and Beyond. So it's going to be talking about nutrition specifically for lymphedema and lipedema. And we have a whole bunch of great speakers, including Siobhan. And I do believe, Siobhan, is that your intention to, as Lisa was asking, are you going to share stuff about this project, exogenous ketones? Will you be sharing that at the heart-to-heart?
So I think the presentation I'm doing is talking about like people's relationship with food and that kind of whole thing. But I believe what we had discussed, Leslyn, was having a bonus session for people who attend the event to talk about this whole exogenous ketone project and have Heidi on board to also discuss, like I said. So that is something to look forward to. It'll probably be post-event, sometime in the 2 weeks after the event, that we'll be doing that as a bonus session. So you don't just get access to the event, you get access to pre-event sessions and then also post-event sessions.
There is a whole bunch happening surrounding this. It's only a 3-day virtual event, but as Siobhan says, there's a bunch of great free webinars happening leading up to it, and a bunch of bonus sessions happening for all the attendees that came to, signed up, registered for it. It will also get all these bonus sessions after the event. Gail, have I forgotten anything we should be sharing about that the heart-to-heart conference?
The heart-to-heart conference is an interactive conference, so it's not just like a listen and watch while you dinner conference. We will have time to talk to each other, talk to the speakers. We have some amazing speakers. Gabrielle Farber is one of our keynotes, and Georgia Eid is one of our keynotes. And for those of you who are together, you're both in the keto, low carb world and the lipedema world. It's like the meshing, it's like the melding of the minds of keto and lipedema, and it's going to be fabulous. But that, I mean, they're like Lisa always says. Where else can you get this? No place else.
Right.
There are so many people who are going to be there. We are going to have a patient panel. We are going to have both Leslyn and Siobhan, both of you are speaking. And it's
will we be having the heart guides again?
We will be.
Tell people what the heart guides do.
So when you go to a conference, so often if it's virtual, it feels kind of sterile, like there's nothing. The audience or you are not connected to us and to the webinar itself. Right. It's kind of like, doesn't matter whether I'm there or not. And the heart guides are a group of community members who have decided that they could get the best parts of the heart-to-heart event to others. So they are going to hold a space for you in the breakout rooms. They are going to make sure, as they see your comments or questions in the chat, that you get noticed, that maybe your comment needs to be brought up to the front. So they're actually in there guiding us with their hearts, both on our side, which is, on the facilitator side, and on the audience and the attendee side. And they're an amazing group. We call it the nourishment team, because they're making sure that everybody's hearts are nourished. They are wonderful. So we're really excited about that. Now, there's a couple of other speakers besides Gabrielle Farber and Georgia Eid.
Yes. And let me just say briefly about those two keynotes. Gabrielle Ferber was heavily involved in the German guidelines, treatment guidelines for lipedema, which just came out. They're in German, but I've just got a pirated translation into English. I know, but those have just come out. And because Dr. Farber is so involved in the nutritional aspect of treatment for lipedema, she made sure that this is part of the guidelines. And so she's going to be sharing in previous events, she's talked about what she hopes to have in the guidelines. Now that the guidelines are out, she's going to be sharing what has actually gotten in there to do with nutrition. And we're hoping that this will have impact on other countries that put down their own treatment guidelines. And she's been using keto with her lipedema patients for 15 years in her clinic in Germany. So we're very glad to have her. And then our other keynote, as you said, is Dr. Georgia Eid. And Siobhan, I would love to have you say a few words about her, because she's an incredible scientist and treatment person.
Yeah, so Georgia Eid is, I consider her one of the pioneers on metabolic psychiatry, as we're calling it now.
Yes.
And basically what that means is using nutrition and other strategies like sleep and stress reduction and all that stuff for psychiatric illnesses, for depression, for bipolar. There's a YouTube channel that's really cool about a woman who's using a ketogenic diet for her schizophrenia. So she's also working with experts in terms of like the medication and stuff like that. But it's one of those things that's now getting more and more study on it. And it's something where you need like at least one presentation to talk about the concept, because there's so much that goes into it. It's not just like, okay, I'm keto and now everything is fine. Sometimes it can work like that. In other cases, it's a little bit more complex. And then she also advises this, like what I've started calling the funnel method of dietary change, which is starting with what's probably going to benefit the majority of people with health issues, and then getting a little bit more specific and a little bit more specific and a little bit more specific over time if it's needed. So she advises a slower approach, which is also what we largely recommend people with lipedema too. So I think it's a nice compliment. She is super, super smart. I've seen her present multiple times, and she's so sweet. She's a genuinely nice person and fun to be around.
And you can look at her website, diagnosisdiet.com.
And it's over on my bookshelf, but she also has a book out in case you want to read about that. Yes, there we go. It's called Change Your Diet, Change Your Mind by Georgia Eid. And it is talking about a lot of these concepts. And I would highly recommend reading it. And for people who are in Tribe, we're having a book club next month to talk about the book as well.
Yeah. And we were asking about who other speakers were. Well, we're going to have Jen Unwin, who is a practitioner in the UK, and she's going to be talking about carb and sugar addiction and how to work through that if you want to give carbs and sugar up. And Dr. Tro is going to be there, Tro Kalasian, who is a provider, who is actually, he's able to do treatments in all 50 states. He's licensed in all 50 states. So he does a lot of stuff virtual. And he's an obesity specialist and is becoming a specialist for lipedema. Let's see, who else? Brian Wiley, who works in Dr. Tro's office. Is that correct, Siobhan?
Yeah. And Brian is going to be talking about kind of low carb on a budget. He's written a really good article about it, but we wanted to kind of present this information because one of the concerns of changing your eating patterns, and especially with low carb, is, for people with limited budgets. I've personally worked with friends and family members who are in that position. It's definitely doable. However, it is a skill set that needs to be developed in terms of like understanding all the tips and tricks and things to set aside and things to definitely include. So I'm really happy we'll have him on board too.
Mm-hmm. And I'm just going to have Gail, you talk a little bit about this new, I guess it's a podcast that's starting up on Monday, because we've been, and Lisa actually is posting a lot right now and making sure that we mention certain things. And Lisa is going to be doing a podcast along with Catherine starting on Monday. Could you talk about that a little bit, Gail?
Yes, the podcast, they're doing a 6-week special series podcast, and it's going to be Dr. Catherine Seo, our founder and CEO, not only of Lipedema Simplified, but Lipedema Project, and Lisa Dury, who is a entrepreneur. She is our managing director. She is the founder of RLD Group. She coaches companies, large companies, to prevent burnout among their staff. She's amazing, and Lisa is actually here. So Lisa, if I have forgotten anything, please make sure that I catch it. Throw it in the chat at me. But so Catherine and Lisa are getting together, and they are going to hold this special podcast and talk about navigating lipedema together, navigating lipedema in the being in the corporate world, raising a family, possibly living alone, being a professional and dealing with fat bias, anti-fat bias, all those things that we deal with as people with lipedema. And so when they get together, they're going to have a chat and they're going to discuss a lot of stuff. And so we don't want you to miss it. However, there is no link, because it's one of these Facebook Live or YouTube or LinkedIn or Instagram or wherever you are. It's a live broadcast. It's at 11 o'clock starting this Monday. It's so exciting that we're going to see them. 11 o'clock Eastern. I was going to say 10 o'clock Central, 9 o'clock Mountain, 8 o'clock Pacific. Well, I can just keep going around the world. But for those of you who know Lisa, she's on Pacific time, and Catherine's on Eastern time. So, they're getting together in the morning, and on Monday mornings for 6 Mondays in a row. So you're really looking forward to that. So I have it here between us, navigating lipedema together. And let me pop the other one up. And I believe it's this. So write this down. Monday, apostrophe. Forget the apostrophe. I don't know where that came from. Monday at 11 a.m. Eastern for the next 6 weeks, starting this Monday. We're very excited to have Lisa and Catherine getting together for that.
And all of you that are here, I hope you will join us. I would like to, there's one comment from Carol that I wanted to put down. Stephen Hare was kind enough to respond to her, but I want to make sure that we respond to her question. She says she's from Rhode Island, where we don't seem to have any providers who are educated about lipedema. And Stephen said that there is a certified therapist in Rhode Island, Mindy Allaire, who is listed in a few of the lipedema sites and has helped with lipedema and lymphedema. So there's 2 places I want you to check, Carol, besides following up on this suggestion of Stephen's, is I want you to go, and I'll get these posts for you to put in there, Gail. I'm going to send you to the Learn Lymphatic Education and Research Network website, that they have a place of how to find therapists in your area. and they're listings of lymphedema therapists. So you're going to need to call them and you find out from that person, are you also, do you understand lipedema, and what do you do for treatment for that? So you want to make sure that they have that understanding. They don't always. The other place I want to send you to is to our website, lipedemaproject.org. And you're going to click on the provider directory, or I think the button might say find a doctor or something like that. And so you're going to find, it has a map of the world. You're going to zoom in on Rhode Island and see what that map has listed there for you. And so, Gail, while you are telling everybody about our Emmy's Box of Hope, I'm going to get these links for you that you can post. So if you could share everybody with which Carol, I want you to get that Box of Hope, and anybody else who's listening, check it out.
So because you've stayed the whole time with us, even if you haven't stayed the whole time with us, you could be watching this on a replay. We have a gift for our community, from our community for our community, and it's called Emmy's Box of Hope. Emmy is a cute little flying pig, and she is our mascot because, pigs don't fly. All these expectations, but Emmy doesn't know that. So off Emmy goes and she flies. And it's kind of like us, right? We have all these expectations, but anything's possible. So we keep flying, we keep living, we keep doing our best. So Emmy represents us. Now I'm going to put this link in the comments, so that you can get your Emmy's Box of Hope. And what is in that box of hope? It's a website, and when you get in there, the first thing it'll say is, "Give me my free resources right now. I want it." Well, actually, it doesn't say that, but it says something like, "Get your free resources here." But you get in there and you want your resources, so you click on that, you register, and boom, you get a website where, boy golly, you could probably go down some rabbit holes. The first thing I want you to know is, if you look across the bottom of our screen here on the right-hand side, it says Learn, Connect, Belong. Those are our three main categories. And on Learn, that's where I want you to go first. It's where it says Learn, if you need to. Because in there, we have 2 postcards. One of them says, "Do your legs look like this?" It has the pictures of our legs, right? Because we know what our legs look like.
Mm-hmm.
It has information on both sides. The other postcard says, "Do your patient's legs look like this?" Right? And it takes you to a link. It takes your doctor to a link where they can get information as well, to the clinicians link. Emmy's Box of Hope has so many resources in it, you can get overwhelmed. But I want you to know, take it in tiny little bites. It was created by Deb Jersick, Julie Stewart, Blanche Pepitone, Judy Green, and Jerry Hamill. 5 of our community members created this for us, along with our tech staff and our social media staff, who put it together in a beautiful package. All of the artwork was done by Deb Jersick. It's a lot of fun. Leslyn even teaches a little juggling. Notice how I'm juggling. Juggling.
Well, and like this, because we were doing scarves, and I just had my friends, they're jugglers in Phoenix, Arizona, and they just called today and said, "So, did that video that we helped you make, did that work out?" And so I wanted to, I want them to go to the link too, so they can see how it was used.
Right. So make sure, if you get the chance to go to, and you want your own Box of Hope, Emmy's Box of Hope, go get it. It's free. It's for you. We made it for you. Our community members made it as a gift to the community, gift to the world. So please make sure you get in there and dig around in it and find out all kinds of information. So Leslyn, made sure that I got a link to our directory or to.
I put a couple things in there for you. One is our provider directory that's on the lipedemaproject.org website. And that one has the map of the world, and you can go in there and find your little area and see who's listed there. And then you might have more people that are listed through the Lymphatic Education and Research Network link that I also gave. But this one isn't specific to lipedema. These are lymphedema therapists who might also treat lipedema. And so you're going to have to call and make sure that that's the case. And then lastly, I gave for you, Gail, is a link for the Collaborative Science Conference where Siobhan and you and I are going to be in Las Vegas next weekend. So lots of things for you guys to all enjoy, and the links to follow up with and play with.
So if you're looking at this all at one time, you'll see link, and with that, just check each one out, because you have Emmy's Box of Hope, you have the directory, the provider directory, the therapists directory, you have the collaborative science. So you have 4 links, boom, 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 all in a row. Don't give up. Just keep going. Leslyn, before we go, there is a.
I saw a couple questions posted. Can we do those really quick?
Yeah. The first question that was posted is by Sing It. And yes. This is one when I saw it, I really wanted to make sure we got it answered.
Let's talk about that.
Okay.
It just came from my lipedema therapy consultation, was told salt makes lipedema worse. How true is this, being a ketovore? So, and I know you have something to say on this as well, Gail, but this is a common question, and it is also a common belief. And your typical clinician is going to think this, because this is old school. And it's very true if you're on a standard Western diet that's very high carbohydrate. But what happens when you restrict your carbohydrate intake, you have less insulin. And one of the things that insulin does, besides telling you to store fat, but when you have insulin around, it also tells you to hold on to salt. And when you are not having carbohydrate, thus you don't have insulin running around, you end up peeing out all your salt, and you get dangerously low in salt. It's way more dangerous to be low in salt than it is to be high in salt. Salt does not make your lipedema worse if you are restricting carbohydrates. Also, we have to make it clear that we don't know your individual medical situation. So it's always good to talk to your medical provider, not just your therapist, but your primary care physician or whoever you use as your primary healthcare provider. Ask them, how does this relate to me personally? And just a hint for your discussion is that make sure that their provider knows that you are restricting carbohydrates. Therefore, you don't have a lot of insulin, saying, keep on to all this salt and hold on to that salt and fluid. Anything you want to add to that, Gail?
Well, I'm always glad that I have you with me, because you explain things so well. And I remember years ago when I first realized I had lipedema, which was in 2019, I was at a conference, and they said something about, someone was talking about how, because our fat cells seem to have, the lipedema fat seems to have, or tissue seems to have more, has a higher sodium level, maybe we should restrict it. And but that sodium level isn't accessible, right? And so, but I think with Sing It, she says it makes the lipedema worse. And my question is how?
Mm-hmm.
I'm always going to say, how does it make it worse? If you can prove to me it makes it worse, that's how I would tell my doctor.
Well, and the only thing is that if you were eating a lot of carbs and you had a lot of insulin, that high sodium might cause you to have more water retention, which could make your lipedema symptoms worse. but
Right.
Singit is using Keto. So
Right. And
yeah.
her doctor wants her to cut out red meat and salt.
Mhm.
And I can tell you, if I don't
Mhm.
have enough salt, me personally, Gail Stricker,
Yeah.
at this very moment,
Mhm.
I feel like I get swollen.
Yeah, that is true. That a symptom of low salt is swelling. You're absolutely right. And so what you and what, you know, Singit saying that her provider doesn't understand carbohydrate restriction. So this is what I've done. I have my primary care provider who's local here in my town, but I also have my keto doctor. So I consult with someone virtually who understands using keto. And that I'm paying out of my pocket, because when I want to talk about things like that have to do with my diet, I want to discuss it with someone who understands it. And a lot of our providers don't. And so you can get a keto doctor. There's lots of websites to find virtual people to consult with that understand this.
Right. And it's really difficult because there's a stigma around the word keto now.
Mhm.
And I, you know, when I talk to people, and it maybe I'm, I don't know, avoiding a situation, but I tell people I just eat whole foods.
Yes. Yes.
Right. And then I eat organic whole foods,
Mhm.
and that's what I eat.
Yeah.
And so they don't.
Basically, you're cutting out sugar, and what doctor would not want you to cut out sugar?
Right. I'm cutting out sugar, and I'm cutting out wheat.
Mhm.
And nobody ever has a problem with that.
Yeah.
Right.
Mhm.
But the word keto, everybody has a problem with it. And I'm like, well, I shouldn't say everybody, because that's like, you know, I don't, you don't, but and so it's really very difficult
Mhm.
to discuss, because there's this stigma around keto. There is no
Mhm.
stigma around the Mediterranean diet or paleo or
Mhm.
whole foods.
Which they're all on that keto spectrum or that low carbohydrate spectrum. And somewhere on there, I mean, like Aileen says she can't do keto. Well, you probably still can do something on the low carb spectrum. And that's one thing that we're going to be a big thing we're talking about at the Heart to Heart event coming up in April, is how to make your nutrition fit for you, and have it be joyful and pleasurable, and and also healthy. So if you're having trouble figuring out how to eat so that it's good for your lipedema but also pleasant for you, join us.
Yeah, and some people just keto itself, it's like, I can't do it, whether it's like, because because it all started out with this many grams of this many grams of this percentage of this. And I
Mhm.
will tell you, I didn't start out keto, and I
Mhm.
use the air quotes. I started out after reading Wheat Belly by Dr. William Davis, and I
Mhm.
got the wheat out of my body,
Yes.
and I got the sugar out of my diet. And then I realized, as the keto movement kept moving along, I'm like, oh, that's what I'm doing,
Mhm. Mhm.
right?
Yes. Yes.
And I realized that's what I'm doing. And so, yeah, now I use the term keto, but
But you didn't know it at the beginning. That's what you
I
were doing, or
didn't
what you were
know.
moving towards.
Well, and they would talk about it. What's the difference
Mhm.
between Wheat Belly and keto? And he would say, with keto, they you limit this, and this, and you get it these percentages. And with Wheat Belly, we're eliminating grains, because so it's a totally different mindset. But then I
Mhm.
look at it and I'm going, yeah, it's keto.
Yeah. And I think, if, for someone who would like to ease into it as you did, or go stepwise, starting with just eliminating wheat and not having anything made out of wheat flour is a great place to start. And maybe that's more accessible for you. Or you might start with just, I'm not going to have any more sugar sodas.
Right, right,
So pick something like that feels doable for you.
right.
And then you
And
can always go more from there.
And that's where when Siobhan talks about this funnel, if you picture a funnel,
Mm-hmm.
you know, sometimes it's finding a food that is causing your inflammation. Simply,
Mm-hmm.
you never know what it could be, right? The first thing, if you have, maybe it's your drink or your additive to your coffee, or
Mm-hmm.
something that has either too much sugar, or maybe it's your soy sauce.
Mm-hmm.
I mean, there might be something that's causing you inflammation. So find out,
Yeah.
find out. And that might relieve the inflammation to the point where you go, oh my gosh, I already feel better.
Yeah. And then it's very motivating to continue avoiding that particular food.
Yeah.
Yeah.
Yeah. And Eileen says sparkling water. Oh baby, I drink sparkling water. I drink the plain kind because I don't like the flavor of the flavored waters
Yeah.
of all,
Yeah.
things. I want it plain.
And if you want some flavor, you can just squeeze a lime or a lemon in it or something. But just having, that's what I do, the seltzer water. It's just
Yeah.
carbonated water, basically. Yeah. Yeah.
Yeah. And some people drink the flavored waters, and they all say, natural flavorings and stuff.
Mm-hmm.
And there's one brand I know gives my family a headache.
Yeah.
Other people drink it right and left. My family gets a little headache from it. And it's probably because we're reacting to something in the natural flavoring
Mm-hmm.
that they use. But yeah, we drink it all the time.
Mm-hmm.
And
Some people just will drink coffee, tea, and water. I mean, those are all,
right.
Other
Yeah.
options that work for a lot of people. Some people have difficulty with the caffeine, or they have difficulty with the artificial sweeteners. And so when you're looking at the drinks, sometimes there is something that you think might be benign, that it's not so much for you. So,
Yeah.
but we have talked a lot longer than we should have, but we can't help ourselves. It is so fun to be here with all of you, and we love responding to what you guys put in the chat and discussing it. I will just say that in a couple of weeks, I'm going to be on Gail's podcast. So we'll probably be talking about this stuff and more if you want to join us for that podcast.
Yes. It's the Tuesday after collaborative science. So it'll be
yes.
collaborative. Yes. Yeah. And I just want to say, Stephen Hare, thank you so much.
Yes.
Carol McKenna, bringing that topic up. Carol brought the topic up. Stephen said, hey, there's this person, and she's just reached out to make contact. So thank you so much. That is the beauty of our community.
That's how we help each other. Yes.
Okay. So what time? Sing it. I'm assuming that the what time is when is Leslyn and Gail getting together? It's going to be on a Tuesday, the 19th, and it will be at 7 p.m. Eastern. And you'll get whatever message you get to come to this on your YouTube, or on YouTube, because that's where you're coming from. That's where you come here too. It's the same message that tells you that we're here on Fridays. I'm there on Tuesdays in the evening, except on lessons there every other Wednesday. Catherine and Lisa are going to be there on Mondays in the morning.
We're on here a lot.
Catherine's there Sunday afternoon.
Yeah.
I mean, it's this is where we do it. So whatever link that you get however we're here, whether it's an email or a subscribe to this podcast, whatever it is that you get it, we're here. I'm here on Tuesdays with a guest.
Yes.
So
yeah,
it's going to be fabulous.
With that, we're going to start wrapping it up. I will just say really quick to Catherine Powell asked if a power plate is essential for losing weight with lipedema and lymphedema. No, it's more of restricting your carbohydrates, but there are wonderful benefits from using a vibration plate. And that might be a discussion of a next talk that we get together and talk about. So thank you for bringing that up, Catherine. And we will see everybody next Friday again at this time. And actually, that will be at the COSI conference. I'm wondering if we are going to be having this on next Friday. We may not, because we might be.
We gotta talk about that.
Yeah, we might be at the conference and busy, so we may not be doing this next Friday, but there'll be many other opportunities for you to see us throughout the week, as Gail was just saying.
I'm gonna have to look and see who's speaking at that time, because that's 1:30 Pacific. So I'll have to double check.
Yeah.
So okay, you guys. Have a great
Bye-bye.
talk to you soon.